live for another episode here. I'm Dr. Cliff Olson, audiologist and founder of Applied Hearing Solutions in Phoenix, Arizona, and I am here with my co-host.
Hello, everybody. My name is Rachael Cook. I'm also an audiologist at Applied Hearing Solutions. Thanks for joining us today. Final answer. Today is going to be 3 out of 3 on Cochlear Implants. So we're really going to try and wrap it up today. We've got a fully loaded episode for you. We're going to start off talking about some of the different manufacturers and products that are available from these different cochlear implant companies. We will also have a HearingUp spotlight provider. Nashlea Brogan will be joining us today. Then we're going to continue talking about some of the manufacturers and a brief overview of the surgical process, and then we're going to be talking about outcomes after the surgery. So if you haven't already, please make sure that you like and subscribe to the channel. That way you never miss any one of our videos. And make sure that you're asking questions early and often. We've got Kelsey back today, so she will be helping us with moderating the comments and questions. So ask away.
Awesome. All right, but let's jump into our first sponsor now. If you guys were not paying attention, yesterday was actually a pretty big announcement from one of our sponsors, ReSound. I've been talking about the ReSound Omnia receiver and canal hearing aids for quite some time at this point. The Omnia is the latest platform that was released by ReSound, and it was specifically designed to help you understand speech better in a background noise situation, which I know that everybody who uses hearing aids is looking for, as well as cochlear implants is looking for. Their new front focus feature inside of the ReSound Omnia lineup gives you a 4.5 decibel signal-to-noise ratio improvement. Now, if you don't know what that means, that is a massive improvement in speech understanding, because every 1 decibel of signal-to-noise ratio improvement is equivalent to around 5 to 10% improvement in speech understanding in background noise. So when you start looking at a 45% increase in speech understanding there, that's a huge improvement. On this big announcement, though, ReSound has expanded the Omnia platform to all of the different styles that they have. So if you're looking for a custom hearing aid, if you're looking for a receiver and canal hearing aid, even the new mini receiver and canal hearing aid, or even a behind the ear hearing aid, you can now get this Omnia technology inside of those different styles. Now, if you want more information on this, make sure that you go to resound.com. I also have my reviews up on my YouTube channel, so make sure that you go to YouTube and check those out as well.
Okay, great. Well, we're jumping straight on in. So if you haven't already, after today's episode, go back and watch part 1 and part 2 of this series. Stay tuned for today. It'll make sense still, I think. But we're going to be starting out talking about the different manufacturers. And with a cochlear implant, there's really 2 main components there, which is going to be the internal electrode array and then the external processors. And so the first company that we'll be talking about today is called Advanced Bionics, and they actually have a couple different types of electrodes. And so the first graphic that we've got here is their straight array. And from the previous episodes that we were talking about, there's 2 kind of insertion types, this straight array and then more of a curved array. This is the straight array for Advanced Bionics. As you can tell, it's very straight. But then we also have the mid-scala electrode, which is curved, and that is actually in the effort to preserve some of the cochlear structures, try to retain as much of that residual hearing as possible with insertion.
Absolutely, and it's really neat because you can tell that it follows like the shape of the cochlea, how it curves around, which is great. But that's the internal component that Advanced Bionics have. They also have their external components, and they do have different ones for adults and for children or pediatrics, and we have graphics of both of those that we can pop up on the screen here for you guys to take a look at. Now, in the very center of the screen, you can see that is their implant portion, but on the outsides here, you have the adult implant on the left-hand side of the screen that is called the Marvel Naida, and then you also have the Marvel Sky that is on the right-hand side of the screen, and I think the colors are fitting there. Children tend to be a little bit more fun, a little bit more colorful types of implants there, but they look very similar, and to be honest, the functionality of the processors themselves are very similar, but there are differences with how you would set up these devices feature-wise for children versus adults.
Yeah, and we just wanted to show you as well kind of what they look like on someone as well, and you'll see here the cool colors are not only reserved for kids, right?
There you go.
So this is an example of the Marvel Naida processor on an adult, and then we also have a photo of the processor on a child as well, just so that you could get a feel and an understanding for what that kind of looks like.
Now they mix match the color.
I
Like, now
know.
this is not fun.
I
I
know.
mean, I think the white looks great.
Yeah, no, it
I
does.
mean,
It
it
looks
kind of has
pretty
like
good.
that Apple vibe,
Yeah,
you know,
I
so
like it.
kind of cool.
I like it.
But then if we also look at like, okay, so let's look at the processors and see what they actually look like in terms of components. And we have a graphic here that shows you the back of a processor and where the different microphones are located. The crazy thing about Advanced Bionics is that they actually have, I guess technically 4 microphones on here. We have the front mic, there is a rear mic on that as well, and then you have the T mic that actually goes down over the opening of the ear canal. Now, the fun story about this is that they actually developed that T mic with the intent of people holding a phone up to their ear to be able to pick up the audio of the phone better. And what they found is that they actually got a performance improvement just by having it down by the ear canal inside of your pinna, because you get a little bit more of a pinna effect from that. And if you guys don't know what pinna effect is, make sure you go check out my videos talking about that as well. And then they also have a headpiece microphone that you can see there on the headpiece, which is like the magnet that attaches to the implant on the underside of the skin. And I will just add a little side note, as an audiologist, when we're going through troubleshooting with a processor, if one of the different microphones get plugged up, you can actually test out different microphones on there to troubleshoot which microphone is having the issue.
Yeah, and I really appreciate that there are these 4 microphones. So the T mic that you saw at the opening of the ear canal there, that's actually, Advanced Bionics is the only one that's got that, and that's pretty cool. Like you said, taking advantage of that pinna effect there. But the microphone that's actually up on the headpiece or on the magnet portion, that's nice too, because that allows them to actually encase the ear-worn processor so they can kind of waterproof the device and allow children or adults to kind of splash around and swim with their processors on and not have to kind of sacrifice that fun moment. And I actually was at a water park once going around the little lazy lagoon, and a kid in front of me had dual processors and had his waterproofing kits on them and everything, and I was like, yes, didn't even have to miss out on hearing at the water park. This is
awesome.
great.
I love it.
Yeah, so that's a pretty cool thing too. Now these devices, these processors also are compatible with Phonak devices, and that's pretty cool. You do have to have a particular device, so let's say you only get one ear implanted, and in your other ear you still have a good deal of hearing loss on that side. You could use a Phonak Naida Link M, and that would actually allow the processor and the hearing aid to kind of communicate in the same type of way, stream things to both sides like media or phone calls, and that's pretty nice.
Yeah, and you know, we actually call that a bimodal setup. We'll talk a little bit more about the bimodal setup later in this episode, so make sure that you stick around. But Advanced Bionics is actually owned by Sonova. Sonova also owns Phonak, so it makes sense that they had some cross compatibility with this, with the streaming and the other setup of their devices. Now, sometimes we send patients off to go get a cochlear implant. They end up getting Advanced Bionics. They end up bringing their Naida Link hearing aid back to us, so we actually do the programming of the hearing aid on the other ear. So it's not that you're going to be never seeing your audiologist, your hearing aid audiologist ever again. They might potentially be working with you if you're a bimodal setup in this particular case. The other option that they have is a cross device for your opposite ear. So technically speaking, if you have 2 ears that are not hearing well at all, the one of the ears would be fit with the cochlear implant, and you could put a cross transmitter on the other ear. We do this all the time when we're talking about hearing aids, but you can also do it with their cochlear implant as well. It will take sound from the ear that is not implanted and transfer it over into the implanted ear, so you can actually have some speech understanding and overcome what we call the head shadow effect from the ear that is not implanted.
Yeah, I think that is incredible. That's awesome. You can also stream from iPhones and Androids to your processors without having to have an additional streamer device. And so in the past, what you had to do was have some sort of intermediary device, some sort of neck-worn loop, or a device that your phone would connect to, and then your processor would connect to that. Not anymore. Now you can do that direct streaming from the iPhones and Androids straight into the processors without the need for another device. And you can actually be paired up to 11 devices at one time with these processors. You can only stream from one thing at once, but you can keep your pairing with all those other things so that you can kind of seamlessly transition between different devices.
Yeah, which is super cool. And then the other thing that I really love about the wireless connectivity kind of staying inside of that thread here is the Roger accessories. Now, I've made I don't know how many videos talking about Roger microphones, but these microphones, because they're made by Phonak, basically, they're cross-compatible with using them with advanced Bionics. So you can actually directly stream audio from any one of these different microphones right into your advanced Bionic cochlear implant as well, and get all the additional benefits that you would get normally if you were to use these for hearing aids as well. And so you can get a significant signal-to-noise ratio improvement. If you guys were listening to my sponsor plug earlier, you know that every 1 decibel of signal-to-noise ratio improvement that you get is about 10% improvement in speech understanding, and you can get some companies claim you can get even more than 9 decibels of improvement when using one of these. So if you really want to have your cochlear implant and even your bimodal hearing aid potentially have a substantial improvement of hearing, use one of these in a background noise situation.
Yeah, and Phonak and the entire Roger system, I mean, when it comes to accessories, they've definitely got the largest portfolio of those, so you're able to take advantage of a lot of those, which is really nice. Now, we haven't spoken about the other manufacturers just yet, but I did want to mention that there is no off-ear processor for Advanced Bionics. And what I mean by that is that for Advanced Bionics, you will always have some sort of ear-worn processor there. But for the other companies, there are actually 2 off-ear processors, so we'll get into that here shortly. And another thing that's nice is that most of these companies have moved over to having both battery-powered and rechargeable battery processors, and Advanced Bionics has a small, a medium, and a large rechargeable battery. So depending on the length of the day, you might want the processor to be a little bit smaller for certain events, right? Maybe just not as noticeable. So you can use the smaller rechargeable battery. And if you got a long day and you don't care what it's looking like, you can put that larger rechargeable battery on.
And there's actually a weight difference between them too.
Yeah.
So if you're like, I've got this thing, I don't want my, cochlear implant to be, or my processor to be as heavy on my ear, you can go with the smaller battery, or you can even change them out throughout the day.
Yeah.
If you have, let's say weak ears, I don't know, can we say that?
Or children.
Yeah, children, like exactly.
Kids, right? Kids might not have as strong of ears at that point either. So, it's nice to be able to switch that out.
Yeah,
for sure.
and everybody has their own what they want to get or what they want to use when it comes to their processor, just like it comes to with hearing aids as well. So if you feel like a larger battery or smaller battery suits you better, then you've got the choice.
Definitely. Well, we're going to move into our next sponsor segment here, and who we've got up next is Eosera. So Eosera has an entire comprehensive lineup of ear care products, but I just keep wanting to go back to talking about the Earwax MD because that stuff works. They have a kit that you can purchase that has the drops to help break the wax down, and you kind of lean over on your side, put the drops in the ear, and they sit there for about 15 minutes or so and work their magic. And they really work their magic because after about 15 minutes, they also include a bulb syringe in this kit to then flush out anything that you've broken up. Now, if you're someone that that you just produce an incredible amount of wax, you may still need to see a provider to get the remainder of that wax removed out of your ear. But very often in clinic, we will tell patients to kind of start the process for us a little bit and start using some of this Earwax MD before they come in for that wax removal appointment because it just makes it so much easier. So if you're interested in looking at any of the other Eosera products that they offer, make sure you visit eosera.com. However, their entire lineup of products is available at several national retailers, including CVS, Walgreens, Walmart, and more. So keep your eye open for their products.
Awesome. Thank you, Eosera. So we're about to jump into our HearingUp provider segment. Every week, or not every week, a lot of weeks we try to highlight different providers throughout the North America, basically at this point, that have committed themselves to following best practice when it comes to audiology. And this also makes a lot of sense when it comes to cochlear implants as well, in terms of if you are not doing well with your hearing aids, getting you referred into a cochlear implant center to see if a cochlear implant would make more sense for you than a hearing aid would. And today we have a new provider joining us on the set today. And who do we have with us?
Today we have Nashlea Brogan. She got her doctorate in audiology from Western University in London, Ontario in Canada. So she's our first Canadian HearingUp Spotlight provider. She has been practicing audiology since 2004 for the last 18 years, and she is the owner and president of Blue Water Hearing and Balance in, I'm going to let her say the name of these cities and provinces because I'm going to get them wrong. But she also works for the Ontario Association of Professional Audiology Clinics as well. And what is so cool and why I'm so happy to have her on today's episode is because she was actually born with normal hearing and has a gene that resulted in her actually losing her hearing after the language development periods. And she was first fit with hearing aids at age 18 and then actually moved on to get cochlear implants. She got her first one in 2012. She got her second one in 2013. And she wears Med-L processors, which we'll be talking about here shortly, the rechargeable Rondo 2 and the Sonnet 2. So yeah, I think let's just jump straight in. Nashlea, thank you so much for joining us today.
And thank you for having me. It's an honor to be here.
I have to know how you pronounce the city.
It's Sarnia.
Okay. Not too hard.
You
I
probably
could have gone for
No.
it.
Yeah,
I could have gone for it. Okay.
Yeah.
It's always good to ask.
Yeah, definitely. Well, I guess our first question that we have for you is, because you have cochlear implants, you know that there's no one brand that's going to be perfect for everybody. So what things do you take into account for you and your patients take into account when selecting which kind of cochlear implant to go with?
Well, usually when I see them, it's at the point with the hearing aids. So I'm in at the private practice side. So their hearing is slowly decreasing. We've tried traditional hearing aids amplification, the newer technology, and it's not working anymore. And then we refer them to the cochlear implant program at the hospital. And what I've always recommended to my patients who are going in is to let the cochlear implant audiologist guide them and the surgeon there and what they think's best. So they might work with different products, but obviously what the surgeon is more comfortable working with, and also what the audiologist feels is the best fit in terms of the product, the features in that product, how it fits on them. So that's what I've always recommended for my patients.
So when it comes to you, obviously you went through this process back in either like early 2012, at some point in 2012, you got implanted with your first one. What was that process like for you in terms of deciding the brand to go with?
We didn't, again, I remember meeting with my audiologist and I put complete trust in her hands. We talked about it. I said, well, what does the surgeon recommend? She says, we feel strongly about fitting you with Med-L, and that I trusted their advice. So I dabbled a little bit in researching it as an audiologist, and then I pulled back because I knew that I did not have the expertise to make that decision. I wasn't doing it daily. I didn't know the product. So I let them guide me in that whole journey. So I just kind of went hands off, even though all day long and even with my own hearing aids for years, I played with my own hearing aids. I programmed my own hearing aids, but when it came to my cochlear implants, I let them do everything.
And were you happy with that decision?
Oh, it's been amazing.
Do you feel like, because obviously when individuals are working with you, with the hearing aids and all of that, when you see the writing on the wall that hearing aids might not be the best option for them, do you feel like people nowadays are becoming more open to the idea of cochlear implantation, or do you still feel like you're getting a lot of resistance from people?
Much more open now. So obviously I've always talked about it because I was very aware of it, because I knew even 17, 18 years ago that I would ultimately need them. So throughout my whole 18 years of practice, I always talked about it with my patients actively. But in the last few years, patients are researching themselves online. They're coming into practice. They're more excited. So it's a little bit of a different battle now because they're researching. So we have to obviously talk about realistic expectations and make sure that once they go in to see if they're candidates. So it's more on my end of it, making sure that they've taken the research, but they have good research from what they're doing online, and that we're preparing them for when they go to the Cochlear Implant Center to qualify for the implant.
That's perfect. And I think, when we think about it, us doing our jobs properly, those of us audiologists who work primarily with hearing aids, it's considered best practice to actually have these discussions and identify when we feel like hearing aids might not be the best option anymore, and to provide education and encouragement to consider other options other than just trying the next latest and greatest hearing aid that we know is not going to be providing them with a ton of benefits. So my next question for you is, why did you feel compelled to join the HearingUp network?
I'm a big believer in best practices, and to join a group of people who have that standard, it's like the foundation of the practice. It was laid out like a map for all my team because I have a team of providers. So I felt like the network and the framework of it made sure that my whole practice and everybody in my practice was following best practices. They literally had a checklist, like we're going to do this and this and this, and they seen that layout, and then they knew that another group was doing it. So it was very, very important for them, and it's really had a great impact because now they do every single thing in the best practices, and I just think it's like the foundation on the whole practice.
That's awesome. We love it. So, one last question I have for you anyway is, what would you say to someone who is hesitant about the idea of considering cochlear implantation?
And I get asked that actually quite frequently by people who are thinking about it from other places. And I think to do your research, but then also trust the professional advice. Usually when the audiologist and the team at the Cochlear Implant Centers are interviewing you and they're asking, they are looking at your history, they're looking at your language development, they're looking at your hearing amplification history. They know if you're a good candidate, so you have to trust them. And I didn't trust, I actually was a very negative view when I was going through mine. Didn't think it was going to work. And she kept saying, no, like you're a great candidate, it's going to be great. So they know what they're doing. So trust the professionals, ask questions, but there is usually a whole team involved in the process. So I usually think in most places it's a very defined protocol and very taken care of.
That's awesome. And just to be clear here, you were so happy with the result of the first one that getting the second one was a no-brainer for you.
Oh yeah, and I could not imagine not having to. Like when I wear one, I only hear 50%. So like if anybody talks another side of my head, I mean, it's literally like one ear or the other ear. So the whole discussion about one versus two, I mean, I always tell people two is definitely way better. Awesome. It's just like hearing aids.
That's great. Well, where can people find you? Do you have any social media or websites where people can get in contact with you?
I do. On my Facebook and my Instagram, I actually post videos daily on living with the hearing loss and my journey and living with cochlear implants. So that's NashleaBrogan.aud on Instagram. And on LinkedIn, I do professional videos. So it's Nashlea Brogan again. And my Facebook is at Blue Water Hearing.
Awesome.
Awesome.
Great.
Well, thank you so much for joining us and taking time out of your day. This might be one of my favorite, and I hate to say that because we've had a lot of great HearingUp providers on, but because it's so unique and you're our first Canadian that we've had on the show, it's special for us. So thank you. Yeah.
Thank you so much. It was great being here.
Awesome. Thank you. Have a good night.
Thank you.
That was great.
That was awesome. That was awesome. So she has Med-L is what she has, but we're going to get to them at the end because I know that now that she's had them, people are super excited to hear about the ones that she actually has, but we're going to make you wait for it. Okay.
We are.
So let's go ahead and jump into Cochlear Americas, and I know that you want to start with the electrodes.
The electrodes. Let's take a look at Cochlear Americas electrodes here. They actually have 3 different kinds. So they have got their Slim 20, their Slim Straight, and their Slim Modiolar. All of these are just going to be based on what type of hearing loss that you have, what your surgeon is most comfortable as far as surgical technique and insertion technique, but they do have quite a few options as well.
And like we just heard Dr. Brogan say, it's like the decision on this is likely good to rely on the professionals that you go to instead of being like, hey, I want to get the Slim 20. It's like, whoa, hold on, buddy. Like, do you even know what that would do different from these other ones?
Yeah, no, I think that there's always good and bad to how much research, and I'll say research, how much online fact finding that you find. And we see this with patients all of the time where sometimes we kind of have to set the record straight on some things because marketing and actual true factual research, 2 very, very different things. So taking the opinion and the stance of your surgeon and your audiologist into account is huge because they have actually done the research.
Exactly, and it's not what you're just hearing on Facebook groups there as well. So let's jump into the processors because they also have multiple styles of processors to go with. But in this particular case, we're not necessarily talking about adult versus pediatric. We are talking on ear versus off the ear. So on the far left-hand side of the screen there, we have the Nucleus 8. So that's your like standard cochlear implant, what you would typically think of, where you have the portion of the processor that goes on the ear and then you have the magnet that goes on the back there. But the Canso 2 on the far right-hand side, that is basically all of that compacted into one device, and that just attaches via the magnet that is implanted under your skin behind your ear. So you do not actually have anything on your ear.
Yeah, so let's take a look at these. So let's look at the Nucleus 8 first. So when it's on the ear, okay, looks very similar to the Advanced Bionics processor with the magnet. Again, an adult with some really fun bling going on their processors. I love it. But then let's contrast this with the Canso 2. So as you can see, there's nothing that's actually on the ear, and there's no connection between the ear processor and the magnet. Like you said, the entire device is actually housed in that one piece.
Yeah, and that looks great. I mean, so if you're someone, we were talking about earlier about having different battery options to reduce the weight, to reduce the bulk on the ear. If you can't tolerate something on your ear, nothing wrong with that. But go with one that gives you the option of having the processor that's off the ear and only is magnetized to the back of your head instead of resting on the ear. Now, there are differences here from a microphone standpoint, too. There are 2 microphones on each one of these different processors, not 4 like we saw with Advanced Bionics. So we have a front and back microphone on both of them, and there's no T-mic that comes down into your ear, and then there's no magnet mic, technically speaking, because the Canso is an entire magnet, but you get what we're talking about here. From the on-ear processor, there's no microphone inside of the magnet.
Right. Now, Cochlear Americas devices are all compatible with ReSound hearing aids from the Quattro line and newer. And that's pretty nice because, again, just like we saw with Advanced Bionics being compatible with Phonak and all of Phonak's accessories, these Cochlear America processors are compatible with ReSound hearing aids and all of the ReSound accessories as well. And in fact, they actually put on their website that 70% of Cochlear America's processors and their cochlear implant users are bimodal, meaning that they have a cochlear implant on one side and a hearing aid on the other side. And they actually put some information up about the bimodal satisfaction rates, and we've got a graphic for this too. You can see that the satisfaction rate from before their cochlear implant surgery while using 2 hearing aids was a whopping 9% satisfied. And after getting implanted just in one ear with a hearing aid on the other ear, that satisfaction jumps up to 95%. I mean, that's pretty significant.
That's pretty big. And I've even, going through school, everyone would always say, it's like, listen, the bimodal users, those guys they perform the best right out of the gate.
They do.
So if you have usable hearing to some degree in the opposite ear that you're not getting implanted right off the bat, I bet you if we were to ask Dr. Brogan that she was wearing a hearing aid in the opposite ear before she got her second implant, probably because she benefited substantially from using that.
Definitely. Now, you can also stream from Apple and Android phones to these processors, so that is great. And like I said, you can pair up with any of the ReSound accessories. However, Cochlear has an entire portfolio of accessories as well. And so you can see they look very similar to the ReSound accessories, nearly a one-to-one. But they've got a couple of remote mic systems, phone clip systems, and also a TV streamer there too.
Absolutely. And then, the Nucleus 8 and forward, this is crazy. So if you guys don't know what Auracast is going to completely change the landscape of how individuals with hearing loss stream, and even individuals without hearing loss, how they stream into their earbuds and headphones and all of that. I want you to think about how upset you get when you go into a public venue and they do not have a hearing loop installed for you to use your telecoil on your hearing aids or your cochlear implant. Auracast, I believe, is going to change that in the future, where you're going to be able to go into a public venue and it's going to become so ubiquitous, this new form of Bluetooth, to where you're going to be able to tap into the Bluetooth audio of the venue and get a direct audio feed, just like you would with a telecoil. But you can also share audio streams with other individuals as well. If you and your partner or your sister or brother, whoever, if they're streaming something from their phone, all of you can use whatever, cochlear implants, hearing aids, earbuds that you're using and tap into the same audio signal so you can share audio, which is really cool.
No, that's going to be amazing, definitely. There's also a bunch of rechargeable battery options for Cochlear Americas as well. So really kind of anything you want, battery powered or rechargeable, you can have it.
Totally cool.
Yeah.
Awesome. So that's it, what we got for Cochlear Americas. Again, another fantastic brand. I mean, here's the thing. all three of these different companies are fantastic at what they do. I am a firm believer that you cannot go wrong with any one of them, and you saw how big a fan Dr. Nashlea Brogan was with cochlear implants in general, and she didn't even mention which ones that she had. We were the ones who mentioned, I believe, right? And which just goes to show that she's not, brand agnostic here. She doesn't believe that just one brand is the best brand. It really depends on who you go to, what they're comfortable working with, how good the surgeon is with any particular brand, and all of that. And so it's just neat to see that someone who's a bilateral cochlear implant user would feel that way about cochlear implants and not be so ingrained in one particular brand, even though she has one of these brands.
Right. It's always good when you can stay a little bit neutral in these discussions, especially being a professional that has those devices, right? Because there's plenty of audiologists out there that wear hearing aids too. And so people are like, what are you wearing? Tell me everything.
And then they push their brand.
Are they perfect?
Yeah, exactly.
And then the audiologists are like, I don't even want to tell you. I don't want to skew you one way or another, So, well, speaking of then Med-L, the processors that she does have, I've got another graphic of some electrodes for you. And holy moly, Med-L has the most out of all of them. They have straight arrays, they have paramodial arrays, curved arrays, and they also have a large variety of hybrid arrays for individuals depending on how much hearing loss they have and where that hearing loss is. Then we've also got the processors for them too. These are going to look very similar to Cochlear Americas, where they have a standard on-ear option and they also have an off-ear unit. So their on-ear option is called the Sonnet 2, and we've got a picture of that as well being worn in real time. Perfect. And then they also have the Rondo 3, and that is their off-ear unit that looks like the Kanso, and that one is right there.
Yeah, one thing I really like about the Sonnet 2 is how slim it is. So, I mean, that is a decision maker for a lot of patients when it comes to hearing aids, if they can actually fit a hearing aid behind their ear. And if they have a very narrow space there, sometimes you can't use some of the thicker devices. And so that Sonnet being super slim, and then, of course, if that doesn't work, they do give you an off-ear option as well. And, it's one of those things where you can really choose which one is most appropriate for you in that scenario. And I have seen cases where people have both of them, and they switch back and forth between their Sonnet and their Rondo as well.
Most of the time you get a accessory device kind of with your processor, and so you can actually pick the Kanso or the Rondo as your accessory device, which is pretty cool because then you can just swap between them as you wish. And now Med-L, their processors are not actually directly compatible with any hearing aid brands, which is fine. You would just still continue to wear a hearing aid of your brand of choice on the ear that's not implanted and have your processor on the other side. It's just for streaming purposes, you would really have to pick one or the other, which one you prefer to actually stream through at that moment.
For sure. And they do have an audio link accessory for streaming as well. And it also works as kind of like a multi-use tool where you can use it to talk on the phone, you can listen to music, you can use it as a remote microphone, just like the Roger devices or the Cochlear Americas devices, and you can use it to stream the audio when you're watching TV. Now, another cool thing about Med-L is that they were the first cochlear implant processor to be approved for single-sided deafness. When you look at throughout history, it was kind of like, well, if you have one normally functioning ear, then we're not going to let you get a cochlear implant in the other ear, because you have one good ear. Well, they actually did a bunch of research, and they showed that actually having a cochlear implant to treat single-sided deafness is actually beneficial for individuals. So, shocker, I know, right? If they had single-sided deafness. So now that's an additional option on top of using, a cross amplification, on top of using a bone-anchored stimulation as well, or a bone-anchored hearing aid to transfer that sound over. So it's really cool that they're the first one for that. We just need to get Medicare on board with covering that, because as of right now, they do not.
Yeah, they still force you to be a bilateral candidate, unfortunately. Something cool about Med-L as well, and we are actually about to get into this entire discussion about getting MRIs done, because in the past, you weren't able to get an MRI done without actually getting the magnet removed, and because that's implanted underneath the skin, They would have to actually go in and surgically remove that magnet, get your MRI done, and then get the magnet reinserted after the MRI. But Med-El actually released their S-Vector magnet for MRI in 2014, and this magnet is sitting inside of kind of a little case, and as the MRI makes the magnet move, it actually can rotate in 360 degrees inside of that little casing, so you can get an MRI done without having to get the magnet removed, which was huge.
Yeah, definite big draw for that if you're someone who has other conditions going on where you'd need to have that an MRI done fairly regularly.
Right.
Not only does it mess up the image, but it can actually pull, because it's, anything metal inside of there is not a good thing. Now, for advanced bionics, it really depends on the implant and the strength of the MRI machine that you go into, but their ultra high-res 3D implant is able to stay in for all different types of MRIs. And then you have Cochlear Americas. Again, this one depends on the implant and the MRI strength, but their Profile Plus series can stay in for all MRIs. So we're starting to see the natural trajectory here of all the implant manufacturers making their cochlear implants compatible with use in an MRI.
Right. Now, we spoke very briefly about Telecoil earlier when we were also talking a little bit about Auracast, but Telecoils are standard in the Cochlear Americas devices or processors and the advanced Bionics processors. They do have to be turned on as a program by your audiologist and then enacted by the user in whatever environment that you're in at that moment. With Med-El, it actually does not come standard. You do need to use that audio link device that we saw previously. And they have one, it's actually called the Fine Tuner, which is an even smaller remote device that comes with the processor, and that's how you would be able to turn the telecoil
Yeah, critical.
on.
You got to have telecoil access, but someday I think that we potentially will not need that if Auracast ends up being as popular as I suspect it will be.
Right.
Now let's talk about hybrid really quick. We talked about hybrid technology either last week or the week before, where you have this combined component of electrical stimulation from the cochlear implant as well as acoustic stimulation. It's really from the implant too, but it's kind of like a hearing aid component of the implant. Advanced Bionics is not compatible with hybrid, but Cochlear Americas and Med-El are compatible with hybrid technology. So if that's something that your surgeon as well as your cochlear implant audiologist think might be a good idea, it might steer you in that direction of those two brands.
Right. Now, why we started with reviewing all of the manufacturers first is because you actually have to make that decision before the surgery happens. They have to know what implant or electrode array, rather, that they're going to be putting in. So we decided to walk through all of that first. But we did want to give you just a brief rundown of how this surgery goes and kind of what to expect from it. We've alluded to it in that first episode, but we wanted to talk about it a little bit more here. So for the surgery itself, you are under general anesthesia for this procedure. However, it's only about 2 hours long, sometimes even faster than that. And it is an outpatient surgery, so you are generally going home same day as well, which is nice. But we've also got some graphics here to kind of walk you through the process. So let's get that first one up there. And would you mind walking us through some of these?
Yeah, so basically here, this is just kind of showing where everything would sit on the individual here. So we have the speech processor, the behind the ear component of the processor that would go slid in behind the ear, as well as where the actual implant would sit underneath the skin. So just imagine that that's underneath the skin right there. But let's go ahead and go to the next image here that shows what happens. So they basically do an incision behind the ear a few inches long, and then they pull the skin back to expose the bone. And so what they'll do is they'll basically drill a little hole down into that bone, as well as a well to actually have the implant. So really when they sew you up, like, you can't even see that there's an implant underneath the skin there. It doesn't really augment the outer what people see at all. But then let's go to the next picture here, and you can see where they're actually inserting that the receiver stimulator, the implant on the inside. There is a little ball electrode on this particular cochlear implant array, and then you can see that they kind of coil the wire down into the tiny little cochlea there. And I don't know, that could be a straight, that could be a perimodular insert there. We don't know, because all of them naturally do curl around the implant after they're inserted anyway.
Right. Then the next graphic that we've got is when they're all stitched up. You can kind of see the shadows of where things would be, but they've got everything closed off nicely. And then the final graphic that we've got here is just when all is said and done. All you really see after everything heals up is just when you're wearing the processor and the magnet. But once you take the processor and the magnet off, you really don't see much.
Yeah, and then we actually have, I think, another image here after this one, if I'm correct.
Yeah.
And so this is after, so this looks like, fairly young child, maybe infant even.
Yeah.
You can see that is the scar, like right in the center of the screen there. That's what you see when you're done with the surgery after it's healed up. Like, you can't even tell, and usually hair just covers it. And even if hair doesn't cover it, you're really not seeing much of anything there. These cochlear implant surgeons are amazing, and to see how good they are at actually stitching these back up to where you really don't have that much of a scar when you're done.
Yeah, it's incredible. Most of the time there's very minimal pain medications, if any. Like I said, you go home same day, and then you normally go back to see the physician a few days after to just check in on your healing process. And then your first activation appointment, where they're actually turning it on and starting to program the processor itself, isn't going to be for between 1 week and 1 month after your surgery. It just kind of depends on how well you're healing from there. But depending on how well you've adapted to that sound, you may have anywhere from between 6 and 12 mapping sessions over that first year, sometimes even more, really to get everything dialed in as you're just getting used to kind of hearing well on that side again.
Yeah, and you might need some additional therapy that goes along with that, auditory rehabilitation, auditory training, stuff like that. It really just depends on, if you were pre or post lingually deafened, how long you've actually had a hearing loss for, that you have not been hearing sound from that side. I've seen some people pick it up super quick. Some people need a little bit more training over the course of that time period. But you should mentally prepare yourself to have to do some kind of training other than just watching TV.
Right. Though a lot of people like to do that one.
Hey,
so
nothing wrong with watching a little bit of TV.
I was going to say, anything that'll get you to do that audio verbal therapy works.
There you go.
So then we've kind of been discussing, and this was a couple episodes ago, about this idea of residual hearing, right? And a lot of people, their main fear in actually pursuing cochlear implantation is the idea that they could lose what little hearing they have left, and that really scares them, and understandably so. But I was able to find this article here from actually the Brazilian Journal of Otolaryngology, and they were looking at how much hearing was actually retained after the surgery, the residual hearing that was left. And the results of this article actually found that 92% of the individuals that received a cochlear implant did not see a statistically significant change in their hearing in that ear after implantation. Now, we also both know of an ear, nose, and throat physician named Chad, is it Ruffin?
Yeah, Dr. Chad Ruffin.
Yeah.
He's up in Seattle, Washington.
Yeah, and he is a bilateral cochlear implant
He's a user.
Okay, there we go.
Yeah,
I kept wanting to say candidate, but no, it's already
no,
done.
It's done.
It's done.
In fact, he's the first. So he's the first cochlear implant user who is also a surgeon who implants cochlear implants.
Yeah, it's so cool. It's amazing. But I was able to actually source one of his pre and post-operative audiograms from a surgery that he did, and I have a graphic of that, and we just have to look at that because if you will look at this picture, in the gray, that is showing their results from before the cochlear implant surgery, and then in the red, it's showing the results after the cochlear implant surgery. I mean, they look
very
great.
similar.
Yeah.
And there's a few little drops there, but there's actually an improvement at one of the frequencies there. But, I would say that is a very high-level preservation of this individual's residual hearing after going through implantation. I know that some people are scared that if I go and get implanted, it's going to make it so I can't ever do anything else on that ear ever, and it does not appear to be the case as much anymore.
Definitely not. Now, I wanted to go through and source some actual results from individuals because, unfortunately, a lot of the times we see cochlear implant candidates, they go off, they get their evaluations done, and maybe they even get implanted, but unless we're working with their hearing aids, we kind of lose them as patients just because they're in cochlear implants now. So I wanted to see, okay, what happens? People who have gone through this process, how did they do? What does their performance look like? And so I took to Facebook, actually, and went into one of the hearing aid forum groups that also has a lot of talk about cochlear implants. And the response was Great. So I'm just going to go through a couple of these quickly. That top left one says, I went from 25 to 30 years as deaf with little or no audible hearing and 0% speech understanding. I now get 95 to 98% speech understanding without lip reading. She actually goes on to say that she's getting her PhD at 70 years old.
That's awesome.
Which is so incredible. That next one to the lower right of that, mine has been a life changer. Wore hearing aids for 15 years, but could no longer hear speech. Now hear men, women, and even kids. It's work, but it's so worth it. The one below that is talking about how their pre-op word recognition score was 33%, and after a year went up to 94%.
That is crazy.
I know. We see that same thing in the one below it. Get the CI. I have progressed from hearing aid to one CI placed in February of this year. I went from hearing 8% in my right ear to understanding 87% after the operation. Love it. And then that bottom one is just saying that I will say it's absolutely life-changing, and if you have the opportunity to get one or two, I highly recommend it. I had a hard time finding anybody who actually had a cochlear implant and was commenting saying that they had a poor experience.
Yeah.
I couldn't find it.
Yeah, it's because they're the closest thing to a medical miracle that I have ever actually witnessed in my life. When you take someone from 0% speech understanding to darn near 90 plus or 100% speech understanding, that is just it's hard to wrap your mind around how dramatic that is. Huge. Going from not hearing to I can hear everything and I hear everything really, really well.
Huge.
Yeah,
Huge.
Just unbelievable. So if you're questioning whether or not cochlear implants work, they absolutely work. Everybody's unique. Everybody's performance may be different. But if you qualify for a cochlear implant and you choose not to get one for whatever reason, I mean, that's up to you. But you're missing out on a very impressive experience and you know, it's life-changing when you're trying to get hearing back to communicate with your friends, family, and loved ones. So
yeah, incredible.
Well, that being said, get your questions ready, guys, because we're getting Kelsey back on here in just a second. But before we do, I just want to see if you guys saw President Biden last night with the State of the Union address. You probably heard him talking about the availability of over-the-counter hearing aids now. So over-the-counter hearing aids are a completely new category of devices for adults with a perceived mild to moderate hearing loss as of October 2022. This means that you can now go online, you can go into a pharmacy, you can go into a traditional hearing aid clinic and purchase over-the-counter hearing aids without having your hearing tested and without a prescription. But you still have to be careful because not all of these over-the-counter hearing aids are created equal, which is why you should check out the Soundwave Sontro over-the-counter hearing aid. Soundwave Hearing is headquartered in Oak Brook in my home state of Illinois. They are a receiver and canal design, and the AutoTune app allows you to program the Sontro over-the-counter hearing aids and makes it possible to customize your own audio settings or customize your audio settings with the help of a hearing care professional. You can learn more about these Sontro devices at hearsoundwave.com, or you can check them out on my website, hearingup.com. All right, well, we got Kelsey back.
She's back. She was very sorely missed last week.
Right?
I got in a lot of trouble for not moderating well, so they are happy to have you back. I tell you that much.
I am very happy to be back, and as always, thank you everybody in the comments for participating, because obviously you guys are the reason that we keep this up and why we keep doing it. So that being said, our first question is, how long does it take to heal before you can use your cochlear implant?
So different places will say different things. I actually, one of my fourth year preceptors, when I was going through my rotation that we happen to do a lot of cochlear implants, she actually did a study to determine can people be activated 1 week after implantation and have success with that and be able to use it? Does it increase like rate of infection or anything like that? And it turned out that you could be, essentially activated 1 week after implantation and have no other issues. Some places choose to let you heal a little bit longer, but that's really going to come down to the Cochlear Implant Center.
Yep, totally agree. Technically, they're actually activating you during the surgery to check to make sure that all of the electrodes are actually working and doing what they need to be doing. So you do get activated well before, but you do need to have a little bit of healing time in between. But like you were saying in clinic the other day, because the magnet is actually placed underneath that skin flap and then kind of pushed back in there, when you have the processor sitting on your ear and then the magnet there, it's actually not touching the surgical site at all. So that's pretty nice too. We're really just making sure that there's no like risk for infection. But yes, between a week and a month is the general window there.
Excellent. Okay, this one says, it didn't take much time for me to adapt to my hearing aids. Is it more work to adapt to cochlear implants?
Depends. I hate to say
I
that. I wish I
know.
had a rock solid answer.
I know, but it's so true with hearing overall. It totally depends on the severity of your hearing loss. How long have you had this hearing loss? Have you been wearing hearing aids up until the point of cochlear implantation, or has that ear been completely unaided for years and years and years? I mean, there's just so many factors that go into how quickly someone's going to adapt or not.
And I feel like people who kind of throw themselves into the fire right away, meaning that I got my implant activated, things sound weird, but you know what? I'm going to go out to a restaurant. I'm going to go into public spaces. You know, those people tend to be the higher performers. The people who tend to be like, okay, I just got this done. I'm just going to go sit at home all day. Those tend to be the individuals who struggle a little bit more with adaptation.
Yeah. Yeah.
The next question actually leads very well into from that answer. Do cochlear implants sound like normal hearing?
I have some funny, so I would always ask people when we would activate them, so what does it sound like? And it sounds like, well, you sound like a chipmunk talking to me,
Mouse.
or Mickey Mouse talking to me. And I'm like, oh, that's interesting. I mean, I don't think I sound that way. Who knows, right? I've listened to myself enough on camera. I know that I don't sound like a chipmunk or Mickey Mouse. But they come back a week later for a week follow-up, and you ask them again, well, how do I sound now? You're like, well, you sound like you.
Yep.
I don't know. It's not a strange sound to them anymore because they've adapted.
Yep. I definitely think that the initial activation process can be a lot like getting started with hearing aids for the first time. People have reports of things sounding metallic or sharp or almost kind of robotic at times. And then you ask them about it a week later and they're like, what are you talking about? And I'm like, oh, okay, so it's gone because you've adapted.
Yeah,
now.
things just sound normal.
They just sound normal at that point. So
yeah, it definitely becomes your new normal.
Yeah.
And that's what's really interesting about the brain and using your brain to hear is that your brain is designed to adapt to the new stimulation. And so as long as you put in the work and wear it as often as you possibly can, your brain is designed to learn new things in that way.
Totally.
So, okay, this is a complex question. How do the electrodes work?
I mean, it depends on how, engineer talk you want us to get on that. So let's talk about standard electrode. Let's say we have a 12 electrode array. But I'm going to try to explain this without any, graphics here. When you insert the electrode into the cochlea, each electrode lines up with a different frequency region inside of the cochlea. And so when a sound comes into the processor and it gets coded for, okay, we need to provide a certain amount of stimulation at these different electrodes at this intensity to code correctly for that speech signal, it can then take that electrical impulse and stimulate those areas of the cochlea to simulate that up to the brain. So when you start looking at the first implants that were ever used, you would have a single electrode array a single electrode inside of the array put into the cochlea. And so anytime that someone spoke, it would just stimulate that one electrode. And it's like, well, that's great, but you're only stimulating 8,000 hertz. That doesn't really do me a whole lot, or a range around 8,000 hertz. So fun story here. That's not really a story, but the first person implanted in the United States got implanted, Halcyon Institute. They extruded that, so they took out the original single electrode implant, and literally, I think it was a month later, they inserted a 4 electrode array into that individual, so they could actually stimulate different areas of the cochlea. But now we have these 12 electrode arrays up to 24 electrode arrays. You have the what does Advanced Bionics call it? They have phantom electrodes because they can stimulate at different intensity levels along the cochlea by directing current differently between 2 adjacent electrodes, so you can stimulate different areas of the cochlea. So hopefully that made sense. I mean, I know you two are audiologists. You're probably like, that was I get it. I don't know if you guys got it. If you didn't, I apologize.
Yeah, it's obviously it's tricky, right? We've put a lot of time into these episodes here now up until this point, and we're always trying to make it as easy and digestible to understand as possible. But we often sit here and go, we can't make it any easier than this. We're going to have to give them the full backstory, the anatomy, the understanding of why things do the things that they do. So I think you did a pretty good job.
Okay. Well,
yeah, that was pretty good.
We'll see. Let us know in the comment section if you liked my response to that.
Yeah, they definitely threw us a curveball there, but again, complex topics down to its bare bones. You did a great job, so it made sense to me. So here we go. Next question is: I am 30 years old and I have never had hearing in my right ear that I know of. I was diagnosed with hearing loss, complete hearing loss, at 5. Is it possible for me to get a cochlear implant?
Possible? Yes. Recommended? I'm not a CI audiologist, so I'm not sure. I would think that they would maybe say results may vary on that.
Yeah, it's going to depend on, obviously the situation is unique, and asking that to a cochlear implant audiologist, you'll get probably a much better and more direct answer than what we would see, because it's definitely a very unique circumstance.
Definitely.
So sorry, that's a horrible answer to
Well,
that question.
I'd say if you're really interested in it, just go get a cochlear implant candidacy evaluation done, because then you can speak to an audiologist that handles this day in and day out, and they would be able to tell you in a more straightforward way if that would be a good idea for you or not.
Cool. I think we got time for one more.
One more. Oh boy, there's way more than one more. Okay, so I'm sorry if we don't get to your guys' question, but this next one is there a difference between the Roger devices and the other Phonak microphones when using a cochlear implant?
I think I'm understanding the question correctly, but you could use in reality, you could use a Roger microphone with a pair of Phonak hearing aids, and you could take literally the exact same microphone and use it with an advanced Bionics processor.
Right. I think if they were using a Phonak partner mic, that would only be able to pair to the hearing aid, and I don't believe the processor. But the Roger mic would be able to.
Yeah, so I am not, even now, I'm not 100% sure of that. That could be the case, and I think it is most likely the case of what you just said. But I know that the Roger technology, because it has everything to do with the Roger receivers, and I know that all of the AB processors, and I mean a lot, not all, but a lot of the Phonak hearing aids have the ability to just upload the software for those Roger receivers into the hearing aids themselves.
Yeah. That's a good question. We may need to do a little bit more research on that before we have a definitive answer on that one.
There you go.
Yeah, everybody threw us curveballs today.
I like
so
it.
I'm really
good.
glad when we get really hard questions, because it keeps us on our toes and it keeps all of the conversation really, really nice. So
yeah,
thanks,
and here in
guys.
the future we will be doing more of those Q&A type episodes where we just do some rapid fire questions for pretty much the entire episode.
Yeah, and then we can research some of those questions that we might not, and it makes us better audiologists, so we appreciate the tough questions,
definitely.
guys. But thank you so much for joining us again today. This concludes our 3-part series on cochlear implants. Make sure that you go back to the previous 2 episodes as well and check them out. Keep in mind, we are here Wednesdays at 4 p.m. Arizona time, and we will see you next week.